Demonstrating hand washing and applying PPE. So I'm going to start with turning the water on, not too hot, not too cold in temperature. I'm going to wet my hands, make sure that my watch and my sleeves are rolled up enough. Grab enough soap for an adequate lather, and I'm going to lather my hands, working in between my fingers, up my wrists, and getting underneath my fingernails. I'm going to lather for between 15 and 30 seconds, so I'll average that out to about 20 seconds. Warm my hands, and then I'm going to apply PPE. So I'm going to begin first with my gown. I'm going to follow that with the mask. Tying first the top, and then the bottom. And then I'm going to put the goggles on, fitting them over the mask. And then I'm going to follow that with applying gloves, making sure that I bring the gloves up over the cuffs of my gown. And that's how you apply it.
Andrew.
Hey.
Hi, Andrew. Can you come with me? What time was your appointment for, Andrew?
Is that noon?
Perfect, you're right on time. Here, step on the scale. Great job. Yeah, grab your hip. All right, Andrew, I'm gonna have you step up and turn to the back of it. Great. All right, you good?
Good.
Plenty of soap.
Hold tall.
You want to lather both sides. Interlacing your fingers.
All right, Andrew, I'm gonna. Okay, 6'1". Great. So we're gonna do a little test. Actually, before we start these tests, can I have your full name and date of birth?
Name is Andrew Joseph Barrett, and birthday is 12/12/89.
Great, thank you, Andrew. And do you take any medications?
No, just a
Any-
multivitamin.
Multivitamin, great. And any drug allergies, food allergies?
No.
Great, okay. All right, so we're just gonna do a little gait movements, all right? I'm gonna have you walk on your toes. Just take like 3 steps. Little steps is good. Okay, and then on your heel. Great, and then, all right, next I will auscultate your lung sound, okay?
Hey,
Is that all right, Andrew?
let me know how they sound.
I will. All right. So I'm gonna start up here, and we're gonna take some slow deep breaths with open mouth. All right, my patient has clear lung sounds, no adventitious breath sounds. And then we'll listen to the apical pulse for 1 full minute. Once I finish listening to the apical pulse for 1 full minute, I'm gonna turn my stethoscope around and listen to all heart sound points with the bell. I'm listening for any extra heart sounds, murmurs. Great, no extra heart sounds or murmurs noted.
Hi, I'm Grace. I'm going to be your nurse today. I saw that your call light is on. Is everything okay?
No, I got to go to the bathroom and I'm just really short of breath. I feel like I can't catch my breath.
Okay. Can you just verify your name and date of birth for me? Checking my patient's name band to make sure I have the right person. So I'm just going to hook you up to the pulse ox to check your oxygen, and I'm going to take a quick listen at your lungs. Also going to put him on the cardiac monitor. Just going to sit you up just a little bit. Can you take a deep breath? Okay. And another. And another deep breath. And one more. Okay. So your pulse ox is a little bit low, so I'm going to go ahead and check the doctor's orders. I'm going to put you on the venting mask to help with that. Make sure it's coming out okay. Put it on 8 liters. And once his oxygen goes up, I'm going to switch him to the nasal cannula. I'm going to put the nasal cannula on 2 liters. So I'm just going to teach you about centospirometry. This is going to help with your lungs. So you're going to want to do this between 5 and 10 times an hour.
Shapiro, my name is Danielle. I'm going to be your student nurse today. And this is Vince, and he is also working alongside of me. How are you feeling?
I'm having a lot of pain.
A lot of pain? Okay, and where's the pain located?
Oh, it's in my chest.
In your chest? Okay. And how long has this been going on for?
A few hours.
Okay. Okay. Okay, let's give him a nitroglycerin.
Okay.
So we're gonna grab some nitroglycerin.
Do that while I get this ready.
Okay, this is just gonna go right under your tongue.
Okay.
Okay. So I'm just gonna have
I'm
you.
really dizzy since you gave me that medicine.
You're dizzy?
Okay, I have.
Okay, so let's check the blood pressure. Anyways, we're gonna put your head down and put your feet up, okay?
So,
So we're just gonna try to get some more blood flow to your head since you said you're
Okay.
feeling dizzy, okay? Hold on this.
How are you feeling right now?
I'm okay. Pain's a little bit better.
The pain is better? Okay, and how's your breathing?
Pretty good.
Good? Okay. Okay, you still having any chest pain or is it still getting better?
It's about the same right now.
Okay. So does that mean on a scale of 0 to 10, what would you rate your pain?
Probably a 5. It was like a 7 or 8 before.
Okay, so it's getting better. So you said you have or you haven't had morphine before?
No, I don't think I've ever had morphine.
Okay, do you know if you have any allergies?
No.
So this might make you feel a little dizzy, okay? A little lightheaded, but it should really help with the pain.
Okay.
So I clean the top of the bottle?
Yep.
Okay. Okay, as keep going up. Okay. So 2 milligrams is so 1 ml. She said 2 milligrams. So she needs 0.2 mLs. Oh, I gotta put oxygen here in it first. Okay. Right. 2.2?
Yeah.
Okay. I feel a little cool, okay? So I'm clamping the hose.
Okay.
That was just a flush, okay? This is the yeah, that's just what I have it excluded. So I'm gonna push this over 1 milligram per minute. So it's gonna be pushed over 2 minutes. How are you feeling?
I'm okay, about the same.
Yeah. It's gonna take a minute, leaving some pain here in a couple minutes.
Induce you so that you can deliver your little baby boy. Because you are 4 times past date, I believe. Yes, you are past your due date, so we're going to get your little boy out. I'm just going to take a look underneath, okay? And just to make sure you're not bleeding or anything, or if your membranes have ruptured. gonna have you bend your knees. Very good.
What are we doing?
I'm just checking to make sure that there's nothing going on down there that we should know about, like bleeding, or if your water has broken yet, because I believe it hasn't yet. So just making sure that it hasn't happened and you weren't aware yet.
Oh, okay. Thank you. I haven't felt anything.
Yeah, and so this is gonna start giving you that crampy feeling in your belly, because we're gonna start with the contractions. Okay, that's what Pitocin is supposed to do. All
Okay, thank you. 15 minutes passed.
right, I'm gonna recheck your blood pressure.
All right.
So
Look at the monitor.
Still 127/79. Okay, 120/69. Very good. Your heart rate's 71. Just gonna take a quick listen to your lungs.
Units.
All right, your lungs sound clear. How are you feeling?
Pretty good.
Okay. Do you have any pain?
No.
What about pressure? You feeling any pressure?
No, not really.
Not really? Okay.
Okay.
All right. Oh, looks like they are now.
Uh,
Okay, so let me call the doctor. Ursula, would you like to call the
Yeah, I'll
doctor?
call the doctor. Let me write down.
So,
Maybe
Do you want anything for pain yet?
71 contractions. 120/6.
yeah, I can't deal with this anymore.
Can we get her something for her pain?
Oh, I
Yep.
just felt a gush.
We will. I'm gonna grab some blood. I'm gonna call the nursing supervisor in.
Why do we need her?
Nursing supervisor. Come here. Just so we can make sure everything's being done that needs to be done. I'm gonna call the doctor and anesthesia to let them know that you are ready for your
Hurry up.
epidural.
we take some
15 minutes
nice,
has passed.
nice deep breaths through your mouth, in through your nose, out through your mouth.
Hi, this is Nurse Samantha. We are in the middle of checking that. We have the fetal heart rate baseline at 120 with increased up to 140. Okay. Yep. Okay, what is she dilated at?
All right, so gonna just check and see how much you dilated since we started. Okay, so your membranes have ruptured and you are dilated at
6 centimeters.
6 centimeters. Okay, so we're not exactly at where we have to be for you to start pushing.
What do I slow it down?
So
Uh-oh, what's going
Turn
on?
you on your left side.
we're just gonna make sure the
Some-
baby's comfortable, okay? He's not liking this
Alright,
medicine
alright.
too much.
Alright.
Yep, so we're gonna raise the bed. We're gonna roll you on your side, on your left.
Okay, I'm rolled.
Okay. So
We're gonna start some oxygen.
Yep, so let's give you some oxygen.
Why does she need oxygen? This is really scary.
This is just to help her and the baby so that because
What-
the
can we
baby's
get a
trying
blood
to use up
pressure?
a little bit more oxygen.
Blood pressure on Mom.
Yeah, so let's get another blood pressure.
First.
Yes.
Mommy, help! Help! What happened? She fell and she's talking weird and she's not. Miss Lujan, what happened? Lacey, can you give me the glucometer? Mommy.
What was she doing before she fell?
We were sitting on the bed and she was talking and then she started mumbling stuff. I couldn't understand her. She tried to get up and I told her not to, but she wouldn't listen to me.
Miss Dujan, hey, do you feel okay?
Are you dizzy? I'm right here, Mommy.
All right, we're gonna get her blood sugar.
What do you think's wrong?
I think it might be really low. We know she's a sensitive diabetic, so.
It's 38.
38? Okay.
Want to check and see if she hit anything?
Hello, this is Dr. Raposa.
Hi, this is Nurse Jessica. I'm calling for a patient, Denise Dujon. Her blood glucose is 38 and her vitals are pretty stable.
Okay, I'm going to have you give 1 milligram of glucagon IM and then recheck her blood glucose in 15 minutes and repeat the glucagon if necessary.
Great, thank you. The glucagon.
Okay. All right, we're just going to give you a shot. Ms. Dujon, hold on 1 second. This is going to help bring your blood sugar up, okay? 15 minutes has elapsed. So we're going to get your vitals again. Ms. Dujon, are you feeling any better?
Hey, Mom.
Yeah? Everything okay? Yeah, we're going to recheck her blood sugar.
What happened?
You had a little fall, Ms. Dujon. Do you feel like you hit your head at all? It didn't look like you did.
No.
Are you dizzy?
A little bit.
Yeah?
Ms. Dujon, I'm just going to take your blood sugar again, okay? It's 80.
80, okay. All right, so we've brought your blood sugar up a bit with that shot, and you should start to feel better if it goes down again. Did you eat your lunch today?
Not all of it.
Not all of it? Did you take your insulin?
Yes.
All right, well, that's what's going to happen if we take our insulin and we didn't eat enough. Our sugar's going to go down too much. So you really got to make sure that you eat enough to, for your body to need that insulin.
Yeah.